wonderful. Thank you so much.
Thank you, thank you. For a long period of time, I'm not regularly relative.
Yes.
I am Parvati. I live in Andaman and Nicobar Islands, Port Blair.
Okay, great.
I
And
just joined because I'm so I believe in all. So somewhere I'm interested in all these kind of healing techniques. I just wanted to explore.
okay, so do you work with your private client?
I'm not working with any client. I'm a retired teacher. I worked for 20 years and I gave
Mm-hmm.
up because suddenly I felt that there is more to life than just teaching.
Yes.
Because I was not happy with what I was doing in the school. Because
Mm-hmm.
children need more of life values than knowledge of whatever it is. Like I was an English teacher, so I wanted to go beyond that. So that's one of the
Okay.
reasons why I quit school and started looking for things in life. And in Portland, things don't happen at all. I
Right.
found life only that whatever I was seeking for during COVID time.
Mm-hmm.
Then I found a coach. That's it. I understand what the purpose of my life is.
Great.
I have all
So I
before
hope
that I have
this session may give you inspiration to start with your client also.
oh okay, okay. My goal was to work with in children in Port Blair only because this place has given me so much in life. I discovered myself. I have seen a tsunami. I have experienced an earthquake. Everything here,
Mhm.
everything. Major whatever exposure to life was here. And this is the place which taught me unconditional love in life. You love anybody whom you meet on the road.
Right.
This place is now it has changed. That's a different story. After the money culture has come in after the tsunami, but before
Mm-hmm.
that, I have seen life, real life. You will go to any place, any island you land. The first thing they give you is food. You
Right.
may be anybody. They may not
Mhm.
know you, but that they offer food.
Okay. Okay. Thank you for sharing your experience. Okay. So how many people joined? 10 people joined, and it's 7:03. Okay. We'll wait till 7:05. Then we'll start. Okay. Anyone who I don't know here is Tuti. Studio, would you like to give your introduction?
Yeah, so myself, Stuti, I am currently working as a school counselor and I'm based out of Mumbai. I've been
Okay.
working freelance, like as a freelancing psychologist with Sun Pharma and Mankind as well. And yeah, so this is all about. Thank you.
Thank you for joining. Okay, everyone, if it is possible, you guys can on your camera. Mm, okay. Okay, then. Okay, some people are still joining. I don't want to start in between. Anyone? I don't know here. Neelam, Ravinder Sharma. If you guys would like to give your introduction, then you can. Hi, Swera.
Hello, good evening, ma'am. Good evening, everyone.
Good evening. Drop a final message.
Lumpi, how are you?
Hi,
Good
Sofa ji.
evening.
Good evening.
I
Thank
would
you for
like to
joining.
know, thank you. I would like to know what's the full form of FSM.
Definitely.
So,
We'll
so,
discuss.
so I mean, just write clearly what are we getting into?
It is to create excitement inside you, what it is, so that you come here and ask me.
So you would wait for everyone to come and then explain?
Yeah. We'll just start. Just wait a minute. Actually, people join in between, na? So it like disturbing for me. I have to again allow them. Just a minute.
When is the main class starting of pendulum?
It will from 13th.
13th of December. Okay, right.
Yes.
Okay. All the best, Limpy.
Thank you. Okay, let's start. It already is 75, 76. The screen is visible to everyone, right?
Yes.
Okay, great. Okay, so this is session secret strategies FSM formula. So I'll explain what is FSM formula. Before that, I would like to give introduction about myself. I'm Limpy Kalita, and I'm the founder of Nurture Mental Health NGO. Most of people you may know me, and I'm a psychologist, and I have done other modalities like past life regression therapy, hypnotherapy, art therapy, color therapy, okay, theta healing, akashic record reading, and family constellation. Okay, so I use all those modalities to treat my clients. Okay, so just before starting the session, I would like you to create a grounding and intention setting. Okay, and after doing this, you will be able to know why it is important. Okay, so intention is more than a wishful thinking. Okay, it's a willful direction. Okay, so I would like you everyone to sit properly in your place. Okay, just comfortably sit in your place. It would be better if you guys can on your cameras. And put the camera in front of you, and if it is possible to make sure that your feet are touching the ground. Okay. If you guys are ready, just give me a thumbs up. I'll start. Okay. Great. So all of you just close your eyes. You guys put off your specs and all. Okay.
The feet should be on the ground or it can be on the bed.
Yeah, it would be better if it be in the ground. Okay, because we'll be grounding and intention setting.
Okay.
Ready, everyone? Great. Just close your eyes. Let's begin by sitting comfortably in the place you are sitting. Place both feet flat on the floor. Feeling the earth or the floor beneath you, supporting you. Gently close your eyes and take a deep breath in. And exhale slowly. Let's do that again. Inhale deeply through your nose, expanding your chest, and exhale fully. Letting go of any tension, any distraction, any stress you had whole day. Now bring your attention to the sensation of your body in the present moment. Feel the weight of your body being held by the place you are sitting, the support beneath you. Imagine roots extending from the soles of your feet deep into the earth, grounding you. With each breath, feel more rooted, more present, and more connected to the energy around you. Let go of anything that is not needed right now. Bring your focus to the space we are creating together. You are safe, supported, and you are here exactly as you need to be. Now, let's take a moment to set our intention for this session. Think about what you most want to receive or experience today. It could be clarity, new insight, deeper understanding, or just a simple insight or perception, or the courage to take inspired action. Whatever it is, hold that intention that today you will be learning something from this session. Hold on to that intention in your mind and your heart as you silently repeat to yourself, I'm open to receiving the highest and best from this session. I am open to receiving the best and highest from this session. I am open to receiving the highest and best from this session. Feel the truth of words resonate within you. Trust that what you need will unfold in perfect time, that you are exactly where you need to be for your growth and transformation. Take another deep breath in, and as you exhale, release any doubt, any resistance. You are ready to receive, and you are open to all that will support you on your path. When you are ready, gently open your eyes. bringing your full awareness back into the room or the place you are sitting. Carry with you the grounding energy and your clear intention as we move forward into the session. Let's embrace this time with curiosity, openness, and willingness to receive the best for ourselves and each other. Once you feel that you are ready, you can gently open your eyes.
Thank you.
Welcome. Okay, so how do you feel? I'll ask that later. Okay. Okay, when everyone is here and now, just give me a thumbs up and I'll start. Great. So we'll discuss this why grounding and intention setting is very much important. Okay. So yes, Shobhaji, your answer is here. Session secret mastery. Sorry, session secret strategies for session mastery formula. Okay. So after working for a long period of time, what I could realize that every session is our first session, right? Because even if you use similar therapy in all of your client, okay, every day you will go to experience different perspective, okay, different experience from your client, and all of us are working directly or indirectly with our client, and we know that although we have knowledge of that therapy, we always learn from the client, right? Every day we learn from the client. And why this thought came to me recently, I came to a clinical psychologist, okay, for a therapy session for myself. So that time I could realize that he is very much of experience, okay, but he was because of he is so much of experience, he thought that whatever till now he had the clients, it will be similar to me because I had the similar problem with his previous clients. Okay, so it is not necessary that we have the similar client, okay, with the similar problem, and the everything will be similar, like whichever client I had before, and his circumstances, situation, everything will be similar. It is not necessary. Okay, so like he didn't hear me. Okay,
Limpy, excuse me, Limpy. Your voice is wavering. It is going low and high.
okay, now it's fine.
30-40% we can't hear.
Okay, now it's fine properly.
Yeah, better.
Okay,
Thank you.
okay.
Sorry to disturb you.
No problem. Thank you for letting me know. I hope it's fine now. Okay. So I was telling that. So recently I was went to a clinical psychologist. Okay. So I experienced that he was trying to impose me whatever my current situation, like whatever my problem, he had similar client. Okay. So he was trying to make me understand that this things are happening to you. Okay. So without listening to me. So then this thought came to me that it is not, like we have that we should have that mindset that if we like every day we work like 10 to 15 clients, if we every day work, so every 15 session will be different. That mindset we should have as a therapist. Okay, you are a healer, you are a therapist, you are a life coach. Okay, so that mindset you should have. Then what happened, then you are free from any pre-assumption, you are free from judgment. Okay, so these are very basic thing I think we have learned in the very first class. Okay, but when come to in practical field, sometimes I think we forgot actually. Okay, because we think that okay, we are very experienced, we know everything, and we try to make things by our own. Okay, which is which can maybe not which may be not harmful for the client. Okay, I'm a therapist, still it was impacting me that this person is not listening to me, he is trying to impose on me. So think of a general person, if we try to impose on them, how they will take it, right? So this because of this also, this intention setting and grounding also came to me. Okay, so I think today I won't be able to give you something bookish thing. Okay, so I was trying to give you what I recently learned actually from my personal experience. Okay, so this ad came to me. I think if you everyone could read Hindi, पहले इस्तेमाल करे फिर विश्वास करे. Okay, first you use it, then you believe in on it. Okay, so this is one more concept came to me, that as a therapist, whatever the therapy module you are going to apply on your client, first it is not possible to completely use. Okay, but try to some extent that the basic thing you can apply, you first apply on yourself. Okay, be the you don't look for the testimonial outside, be the testimonial by yourself. Okay, then only you will be able to give that confidence to the people that you can treat, because you have treated yourself. Okay, so try to use as much as whatever the technique we learned, apply on first yourself. Okay, then try on the family member. Okay, so it is very much important what I have learned actually. Okay, and one more thing is that I have seen so many people, just they have completed their masters or MPhil or PhD. Okay, but not learning, because we learn all those therapy in the class. Okay, in our masters or then, but it is very much important, if you are using some of the techniques specifically, it is very much important to update that knowledge, right? Like we charge our phone every day. It is not that today it is 100%, then it won't go down, right? So in the same way, we need to recharge ourselves every day. Okay, because it is, if it is not, I'm not saying this every day you start a new course, at least once in a year you should learn a new therapy. Or if you are learning at the same therapy, you learn from the other mentor also. Okay, try different mentor, because the same thing everyone will teach in a different way. Okay, don't just stop it. Okay, ठीक है, मैंने master कर लिया, PhD कर लिया, आपको तो कुछ सीखना नहीं. Okay, so try to update yourself, because if you are, see, with time we also increase our prices for our services. If you would have, when you started your journey, if you started, you charge 300 or 500 rupees. Now you feel like that, okay, now I'm 3 years of experience, so I should charge 1500, 1200 or 1000. Okay, so if you think in that way, you also add value to yourself also. Okay, add some new qualities to your learning modalities. Okay, so I'm not specifically telling that you learn this. Whatever you are comfortable to apply, whatever you believe in, whatever you are confident in, learn it. Okay, and update it. Okay. So there is a 2 basket. Okay, from which you will take it, the fruit, the left side one or the right side one?
Right side.
The right side one.
Yeah, the full one, right? In which it is full. Okay, so if you need to give, so if this basket wants to give somebody, so first it need to be full by herself, no? Right? So in the same way, if you want to give someone, so before that you need to be full. Okay, so if you are already every like as a human, it is not necessary that if I'm a psychologist, I don't have trauma, right? If you are a past life regression therapist, okay, you are a life coach, it is not necessary that we don't have trauma. Okay, but it is our responsibility to resolve it before we work on others. Okay, so that's why we need to make ourselves full every day. Okay, before then only we will be able to give, right? Otherwise, whatever we try to give, our trauma, our thought, our judgment will entangle with them. Okay, so we need to be make sure before giving that we are already full. Okay, so am I refreshed before each session? Can I take more session? Okay, so when we continuously take a regular session, so does it happen to you that you are not very hectic or you are feeling very tired after that session? Because we are giving energy, right? When we are talking to client, when we are listening to client, indirectly we are giving our energy to the client, right? So how do you feel the tiredness after session, taking session?
Yes.
Just give me a thumbs up. Yes, we do feel, right? So what do you do to make you refreshed for the next session?
I take break.
Okay, in that break, what do you do?
Uh, I will not do just after that session. I will not take other session. I will take rest. I will drink water. I will relax for some time. After that, I can.
Okay.
Yeah.
Okay. So instead of just sitting and or lying, so we can just use some technique to gain some energy. Okay, so like you can do just simple mindfulness practice you can do. Okay, you can just listen to some short hypnotherapy guidelines. Okay, or I nowadays I just use my pendulum to refresh my aura. Okay, so there are different technique you can use it, because if you feel tired, no, so what happened? What your subconscious mind will tell that I'm not ready to take more session. Okay, so indirectly you are denying to take more client. Okay, so you are indirectly giving your subconscious mind that I can take in a day 2 client or 3 client, not more than that. So indirectly you will attracting less clients. Okay, if it's happen in a regular pattern, so it will it will become a pattern. Then your subconscious mind will learn to attract less clients. Okay, so you need to make sure that you don't that you have that freshness. Okay, you have that eagerness to take next client. Okay, readiness to take the next client. Okay, you should be enthusiastic, you should be energetic to take the next client. Okay, it should not be अरे आ गया चलो कर लेते हैं. It should not be like that you are doing it for money. Okay, you should have the same energy for the first client and the last client. Okay, and it is your responsibility to maintain that energy. Okay, so find out some technique. You can just listen some grounding. I would say grounding. Yes, Anamika ji.
Dimple, I have a question that what are the techniques through which we can cleanse our aura, except pendulum?
Yeah, except pendulum, you can do the grounding. Okay, You can listening to some relaxation music, okay, or you can just have water. Also, you can jump also, okay. Your physical, you can release the physical stiffness, okay. Wherever you are, you can just jump also, okay. So
Okay.
motive is that physically and mentally both you need to be active. Yes, Ashwara.
Yes, ma'am. Like I would like to answer to ma'am the question she asked. What else we can do is I practice like most of the time. I do either painting as my hobby, a short painting, or draw a mandala, or I go for a short walk.
Hmm. Yeah. So it is. In that case, one answer coming to me, you can just try to apply your hobbies in that time. Okay, because it will be like some people may not like meditation, so it should not be like burden. You are doing meditation in burden. Okay, so it should not be. It would won't be beneficial for you. Okay, so try to find
Sorry,
out
Limpi,
which.
but the basic motive is to get relaxed.
Yeah,
Yeah.
it's up to
Otherwise,
you.
aura cleansing is not necessary. You can do
Yeah,
that,
that
but
is.
otherwise,
Yeah, that is the same way, na? So when you clear the aura, okay, you are in the pendulum course, right? So you will feel that okay, you are already refreshed when you have cleared the aura.
right.
Okay,
By
so we
doing
are
exercises and by painting, can we clear our
yeah,
aura?
yeah, like we are releasing the negative emotion, na?
Right.
Because when I love painting and when I'm doing painting, so it is creating the positive energy in my mind. Okay, it is creating relaxation in my mind. Okay, so it is replaced by the negative energy.
Right.
Can
Right.
you
Okay.
Thank you
can
so
you
much.
show a simple method of refreshing your aura using pendulum?
Yeah, I see. Yes, we'll taught all those. Don't worry. Here,
You have
let's not to
already taught?
discuss. Uh-huh.
No, it's going to come in the course, right?
Yes, 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 yes.
Okay, okay.
Okay. So I have made some checklists for like as a therapist or as a healer for ourselves. Okay, checklist for myself. Have whatever we discussed till now. Okay. So have I worked on myself? Okay, which means have I taken the like whatever my issues, okay, if anything happen in my home, okay, I should not carry on that to the client. Okay, I should release all those before this session. Okay, am I aware of, so it is, see, having problem as a person, it will be continue whole life, right? So it is not possible that I first complete my issue, then I'll start a client. Okay, it won't happen. Every day you will come up with the main issue. Okay, but it is necessary to resolve the main trauma. Okay, basically the childhood trauma. Okay, so after working with different client and in the personal life, what I have observed that every person should go through a inner child healing. Okay, you can do with any kind of therapy. You do it by yourself, you go to a therapist. Okay, whatever you prefer, just do it. Okay, see, it is not for inner child healing also, because tomorrow again, if I have something today, tomorrow again it will be like inner child trauma. Okay, so but the major trauma, whatever it was with your family, with your school, okay, till 18, whatever trauma you had, basically till 18, whatever trauma you had, you should work on all those before working as a therapist. Okay, have I applied the therapies on me? Okay. So how many of you are here who has never gone to a therapist? It is not necessary to that you are paying someone. It may be your colleague who is therapist and you have taken. No. Okay. It may be a private question. I should not ask this. Okay. No problem. So you just check on in yourself. Okay. Yes, I can't see Saranya. Yeah.
I need to ask the question that which therapies are very much useful when it comes to treating childhood traumas?
There are different therapy. Okay, so I'll just give you example. If a client comes to me, if the client says, okay, I want to experience it, re-experience it. Okay, I want to go back to my childhood, experience it, and resolve it by myself. Okay,
Right.
then I'll suggest ki you go for hypnotherapy as a regression. Then with that, you do the inner child healing. Okay, if the person is saying no, I don't want to, I don't want to involve all those like direct subconscious involvement. I just want to uh, resolve it with some other therapy. Okay, so then it can be art therapy. With the art therapy also you can do.
Ma'am, if
Okay,
some,
you can.
ma'am, can I just elaborate the question? If someone has lost one of their parents in their childhood, then what kind of therapy do we use for them? And also that in adult life also they have lost the other parent. So both of, matlab, the life has been very traumatizing for that person. So what kind of therapies we use in these cases?
Okay. So, which means that person is very distressed, not in a condition that the person can involve by self. Okay. So, in those cases, I use family constellation therapy.
Okay.
So, there are different module, and you see if it is person is very logical, okay, and motivated to do homework and all. So, best go for the CVT or the art therapy, all those things. Okay, you can give them worksheet. Okay, they can work on that. Okay, so
Okay.
it is, I'm telling you, okay, depending upon the person to person.
Right.
Okay, we can do age regression also from the past life regression therapy module.
Okay.
So there are different module to heal. It is depend upon the client's choice.
Okay.
Okay.
Yes. Thank you.
Welcome. Yes, Anamikaji, want to ask something?
Limpy, like I haven't done art therapy. So, through hypnosis, I can come to know about her inner child problem. Why is it there? But the healing part can be done through theta healing, or
Yes,
can I
you
go in
can
for a
use theta
psychiatric
healing also.
record when
Yes, you are already a theta healer, so use theta healing. Okay, but thing is, clients should believe on that therapy. Okay, any therapy can work. Our motive is to resolve client issue. Okay, the first client should be comfortable use that therapy, and client should believe on that therapy.
Right.
Okay, so you can do with the theta healing also, and yeah, you can do with the theta healing.
Thank you.
Yeah, welcome. So yes, am I mentally and emotionally stable? Okay, so we need to like our own emotion, okay, our own suffering keep aside. Okay, am I confident? Okay, so why this thing can happen that I'm not confident? Why it can happen? Because there may be various factor that if I'm not I have not worked on myself. Okay, if these things are happening, all those things I mentioned. Okay, if I have not resolved my own issue. Okay, if I don't have enough modalities. Okay, like if a client is coming to me and I don't know that modalities to resolve their issue. Okay, do I take, so in those cases, so if you are not confident, if you have just started, okay, so always take support from a therapist, a mentor, okay, and anyone who knows that who is expert on that area, and you are comfortable with to discuss all this. Okay, you should always take support. And am I doing regular healing for myself, outside, inside? Okay, so here come to the role of self-care. Okay, it is not like that you will do matlab, you are caring for your face, you are taking hair spa, you are taking body spa. Okay, you are taking food care. Okay, so all those are outside. Okay, so inside also you need to heal. Okay, so for that the therapy comes. Okay, for inside healing, am I ready to receive? Okay, so that's why I have created that in first that we as a therapist, we should be in a receiving mode. Okay, that today I'm going to experience a new client. Okay, so now I'm going to I'm going to ask all of you. So when you have joined this session, okay, when you have done this grounding, what is the difference you could feel before and after? Who would like to answer?
Sorry, ma'am.
Okay.
Can you
Share your
please repeat?
Please repeat.
Yeah, when you join this session, okay, at 7, all of you join, most of you. So when you join this session, okay, and when we did the grounding and intention setting, okay, what is the difference you guys could feel?
I felt more into the present, like I became more mindful. Actually, I was in the haste basically. I was doing some work and then I all of a sudden remembered it's 7 o'clock and I need to join. So I was not that stable, but after doing it, I was quite mindful about what I am. And even like, okay, I knew what the session is about, though I didn't know the full form of FSM, but still, like, got to know it is about how to go forward, about the sessions and everything. But when we did that intention setting, I started getting ki, okay, maybe if I have any doubt, what kind of doubt I could get answers from in this session, and I got into that path. We can say maybe it was like getting more clarity into what might be happening in the session or all it is about.
Right. Okay. Anyone would like to share your experience?
I became more focused.
Okay. Yeah. So that is very much important. Grounding, relaxation, and intention setting. Okay. I'm telling you, when you go, you start, okay, you do it for yourself, okay, and for your client also. Okay. When your client come to you or they are always in like a very miserable situation. Okay. So when you do the grounding and intention setting, so they will be more into this session. Okay, and you will be also like cut down from the any other thing which is you may be personal, okay, which may be the from the previous client, okay, which may be from the yesterday's client. Okay, so make a golden rule that anything you are going to start, just do the grounding, sorry, just do the grounding and intention setting. Okay, you will, I'm 101% sure you will get different result from that. Okay, whatever you do, if you are starting something new, okay, do the intention setting. Okay, even like if you are like working in a school or like that, okay, if you don't have the time to do for each and every client, what you do when you go out from the home, okay, then do this for the whole day. Okay, if you don't have time to do in between, just do it once when you start your day. Okay, and you can just do when you just get up from the bed also. Okay, and see the result. Do it for at least 1 week. Okay, minimum do it for 1 week. You will see the result. Okay, so whatever, if you feel that you are not productive, okay, if you feel that things are not, you are very undisciplined, okay, if you are not able to make things on time, okay, try to do this, you will definitely see a change. Okay, I'm telling you 101%. Okay, so make a golden rule that from today onwards you will do grounding and intention setting. Okay, so I'll share all those. So for the grounding, all of you got how to do it. Okay, just you have to do it. Okay, this point you just remember. Okay, starting you will be doing deep breathing. Okay, then guide yourself that you are from your sole of your feet, you are connecting to the mother earth. Okay, roots are coming. Okay, what does mean the root? Root has what is the uses of root? Root gives us support. Root gives us stability, right? And make us stable in one place. Okay, so while doing this, when we say that we are connecting to the mother earth with our roots, okay, so which then we are very much in the present, we are more aware. Okay, then release the previous thought, emotion, and somatic charges. Okay, any thoughts, okay, if you are carrying when you just get up from bed, okay, last night or last day something happened and that thing's coming up to you. Okay, so just release it. Okay, release any kind of pre-assumption. Okay, you are going for a session, you are going to learn something, we have different thought, pata nahi kaisa hoga, how this person will be, how the mentor will be, what will get, will it be benefit for me, all those things, right? So when we ask those questions, we are doubting. Okay, so when we doubt, we are blocking. Okay, so in which means we are not in a open mode, we are not in a receiving mode. Okay, release all the negative emotion. Okay, when you breathe out, release all negative emotion, ready to receive all positive energy coming in. Okay, so ready to see, sometimes what happen now, we have that belief, morning, if morning something negative happens, we create that belief, okay, to now the whole day will be vanish. Okay, the morning, at the very morning, I have this, I felt this negative thing, okay, now the whole will be like bad for me. Okay, so it is our just negative belief. So when we start that, we are carrying the negative emotion from the next event towards the next event. Okay, so if something happened to you, do the grounding at the same at the time only. Okay, so I have like mentioned so many points here. Okay, you can just go through. Okay, you can make your own like own script okay, just make your in your own words, make your own script. Okay, from this intention setting, you can just choose some of the lines which is very resonate with you. Okay, I'll share the PPT, we'll be able to know. I'm just reading out one or two line. I'm fully present and focused on this moment, ready to give my best effort. Okay, I set the intention to stay calm, clear, and open to experience ahead. Okay, so with each step, I aim to grow, learn, and embrace the process. Okay, so like this way, I think next slide is also fully with the intention setting lines. Okay, you just manipulate with your situation. Okay, I'll share this. Okay, so the intention setting both for the client and therapist. Okay, for like for you won't be possible to do for the every client. Okay, but you do for the each client, whichever client is coming to you, na. So you do for yourself also, and you make it do the client for the client also. Okay, the way I made all of you do. Okay, in the same way you make them do the client also. Okay, so then your client will be, so what happens, so some of the client comes that, okay, this person will be good or not for me. Okay, so is this person will be able to resolve my issues or not? Okay, so they are so much in doubt in the first session. Okay, but you do for the each session, because as a therapist we set the goal na ki, today we'll go work on this problem. Okay, so for that problem, you set the intention for the client. Okay, but because you are in a giving mode to the client, it is also necessary that your client also in a receiving mode. Okay, we have, I think we have learned in our courses also that the client create resistance. Okay, when client is resistant, create resistance, the intention setting is will work because if you are doing this process now, so the client is, at least to some extent, their subconscious mind will be active if you go do for longer period of time this in grounding and intention setting. So somehow their subconscious mind will be little bit of active. Okay, if they are showing resistance also, automatically if you do in a regular basis, client will automatically motivated for the therapy. Okay, you don't have to force the client. Okay, so do make the rule for the use this for the client also. If you are a school counselor working in a school, okay, if you are going for a group session, do for them also. If you are a life coach, you took session for the corporate area, all okay. So you do before starting the session, do the intention setting and ground. Okay, it will give you immense result. Then one more like one thing we as a therapist we face that should we give them free therapy or not? Our client, okay, free consultation, free session, okay. So with my experience, what I could feel that if it is not necessary to always like you make a rule that okay, I'll give start with the free session. Don't start with the free session. You can just make their prices lower. Okay, if you feel that you are not you don't I haven't built the your field or you don't have much of connection. Okay, you don't have much client, so you can lower the price. Okay, so but what you can do if you are taking online, so some people what happened, so they don't know actually like what will happen in the therapy. Okay, so some kind of people there, so they want to check it. Okay, first they will try it, that ad come to me again, पहले इस्तेमाल करें फिर विश्वास करें. Okay, so what you can do that you can give them 15 minute or 20 minute of free call, free session. Okay, then let them decide. Okay, so in that 15 minute or 20 minute, what you have to do, you try to listen to the client's problem also. Okay, and try to convince them that how you like your therapy will change their you will be able to give them resolution. Okay, so that thing you can do. Okay, and your free session should not be like that you are giving like every like I'm giving you 2-3 session. Okay, one more thing what you can do, you give them free session at the last one. Okay, so the last session you will give in free, you will get in free. Okay, so in that way your client see as you have to definitely we are here to help the client. Okay, but also we need to take care of the our monetary issue also, right? So in that way you should have some marketing mind also. Okay, so don't start giving free session to everyone. Okay, if you are giving something in free, okay, just take something in return. Okay, if it is not monetary, take testimonial, give ask them to give a testimonial, ask them to give a review. Okay, so make them realize that like your service is not like you useless. Okay, if you're giving in free, it's feel that I'm not valuing myself. Okay, if I'm not valuing myself, then other people will also not value myself. They will feel that like I'm available every time. Okay, so and also like here also one more point I would like to add, the when you take history you get to know the financial condition of the person. Okay, so if you feel that the person is very much of interested in taking session, okay, but the finance is a like blockage for them. Okay, in that case you can lower the price for them also. Okay, but you clarify them. You clarify that this is my price because of your situation. I'm lowering my price. Okay. So all like these are some points to like set your fees. Okay. How we are going to set your fees. Some more points like should I take the responsibility to resolve client issue? So what happens as a therapist? Sometimes we are in a like we are in a rescue mode. We have to help everyone. Okay, I have to help everyone. I have to resolve everyone issue. Okay? No, you cannot. Okay, like help those who ask for help. Okay, never ever take the responsibility of the client. heal them, okay, to resolve their issue. Let them take responsibility, okay. And when you take the very first session, you mentioned those point that because every client have the question that their issue will be 100% resolved or not, okay. You clearly tell them, yes, your issue will be 100% resolved if you cooperate, okay. I am here to guiding you, I am here to showing you the path, okay. The action taker will be only you. I cannot take action for you, right? If person have a person goes to a doctor, if it is like best doctor, he is giving best medicine, until and unless client doesn't eat the medicine, client won't be cured, right? So you make them, you have to make them realize in the very first session, because some of the client have expectation that I am coming to the therapist, okay, now my job is done, everything will done by the my therapist, okay. So you should be very clear in the very first session that client need to take the responsibility, okay. So you like, you don't scare the patient, okay, you don't have to scare the client that okay, because they will be already in distress, so you tell them that dear, I will be always behind you, okay. I will always behind you to support you, to guide you all the time until you continue this session. I'll be there with you, okay, but you have to walk by yourself in this journey, okay. So these are the, and you will be able to know that if client is showing resistance on all, okay. So they will be, how you'll be able to know, so they will delay the session, okay. They won't be come up in time, okay. They will give you time and they will just disappear, okay. They will some make excuse, I am having this work, okay, I'm not able to get time. But you are eating, right, you are sleeping, you are getting time definitely. So the client needs should be there to take the session, okay. And as a therapist, you have to motivate them, you have to create the need in the client, okay. How you will create the need, I'll show you, okay. We have time, already 8 p.m. Okay, so just everyone, just close your eyes, okay. Sit properly, close your eyes, take 3 long deep breaths. Everyone ready? I can't see you guys. So I'm assuming that all of you are ready. Okay. Take 3 long deep breaths. Breathe in through your nose. Breathe out through your mouth. Breathe in through your nose. Breathe out through your mouth. Now imagine a blank board in front of you. You have a marker in your hand and write down the maximum current at present, the maximum you can charge from a client. How much you can charge from a client. You may have different services. So among all those, just select the maximum one and write down the price. How do you feel when you are noting down? Just notice that.
The number just came in my screen, the mind
Yeah,
screen.
you just don't speak now. I'll ask. If it is 5,000, imagine it is 5,000. How do you feel? Notice that. If it is 10,000, feel how do you not? How do you feel? Notice that. You are charging 5,000 for a session. How do you feel? Notice that. Or just open your eyes. You can simply open your eyes. Slowly and gently, you can open your eyes. And I'd like to hear experience when I say, like, what is the maximum number? You guys can just type in the chat box. Or if you, anyone, yes, Lena Ji, you want to speak?
I don't
1,000.
know, but maybe I'm already conditioned. I just got it's on my screen that 1,000.
Okay. Okay. So maximum people type 1,000. Okay. So when I said 5,000, 10,000, how did you feel?
To tell you the truth, I was not able to even think on those lines.
Okay. Yes, Rasmus 4,000. Great. Yes, Shwetaji.
Initially, the amount came for psychological counseling 700, but I felt that I won't be satisfied with it. Then the maximum amount, when you said ki maximum amount, it came as 3,200. And for career counseling, when you said 5,000, I felt ki this is good amount for career counseling.
Okay,
I
you
will
were
be
comfortable.
satisfied. Yeah, I will be comfortable with that.
Okay. So this is the like our thought process. Okay, if we are getting clients who are paying us 1,000 rupees, okay, who are paying us 700 rupees, because our mindset is ready to, our mind is ready to receive that only. Okay, that's why our mind is attracting those client on. Okay, so if you want to set a higher price for you, okay, first you make yourself ready. Okay, so the simplest way how you can do that, you can, the way I made make you the grounding, do the grounding. Okay, then do intention setting that now I'm going to charge 4,000 from my client. Okay, and provide, along with that I will be able to provide the value of 4,000 also.
That is the most important thing.
Yes. Okay, and so to provide the value, okay, you also have in that. Okay, the starting I show the full and the empty box. Okay, so we you need to have the full box. Okay, if I'm charging the 4,000 for a session, so the client also could have, you also can show the client that I can resolve your issue with the 5,000, 4,000 or 5,000 or 10,000. Okay, so you could have that confidence that the client won't complain that my money went like vanished. Okay, so write a highest price for yourself. Already we have done. Am I fearful to set a higher price? Okay, so if am I fearful, okay, ask the question yourself, why am I fearful? Okay, what will happen if I am going to charge 5,000 from my client? Okay, what are the qualities makes me high price? Okay, check your quality. Okay, if I'm going to give a value of 4,000, so for that I need to have the quality of 4,000 or 5,000. Okay, so that's why I mentioned you that you should update your knowledge. Okay, when you update your knowledge, definitely your mindset will automatically ready to do it. Okay,
Will you be
because if you sorry,
sorry, will you be sharing this in the chat?
yes, now
No, no,
yes, if
later.
okay, PPT,
I just, yeah, this, yes.
yes, I'll share. Okay, so that's why I make the question so that it is easier for you all to go through. So yeah, if I'm spending 20,000, 30,000 in my course, okay, then definitely I'll have that confidence that I can charge 5,000 definitely, because I have learned something which is more valuable to this. Okay, as compared to 50,000, it is very less 5,000. Okay, so the qualities also need to be provided to the client. What are the different therapies I use on my client? Okay, so you should have that. Like if, as I mentioned, for inner child healing, there are different therapy. Okay, so you could have that capability that I can give different option. If client is saying that I'll go through to that experience, I have that. Okay, if client just say that I don't want to, I just want to observe what is happening, okay, and I want to see it, okay, then I'll go for family constellation. Okay, so you have that, you should have those option. How many session you have taken for yourself? Okay, so you have, if you have worked on yourself, definitely your subconscious mind pattern, thoughts, all those will be changed, right? So that's why you need to work on yourself. When do I set a low price? Already I have mentioned you when you need to set a low price. Okay, so if your client is very much motivated, okay, but they doesn't have, okay, like it should be reasonable, because everyone just say I don't have, okay, but you should check on. Okay, and I have made it actually, I think I don't have right now. So try to make a layout or structurize your like therapy format. Okay, from ending to starting. Okay, what are the different stages you follow? Make a layout of it. Okay, and you show it to your client in the very first session. If you are in a consultation call, okay, make this structure as I made it actually. I made and printed it in a very big one. Okay, and just show them. Okay, make in other language also, English and Hindi. If you are using, I made it in, I think, English and Bengali. So yeah, make the layout and a goal setting card. Okay, so I saw the like effect of this. Okay, when I used it, when you make a goal setting card now for your client, okay, make a printed card. Okay, and make them to write the goal of the session. Okay, what the client are going to resolve after the end of the session. Okay, along with that, what you can add on affirmation. Okay, some positive affirmation. We so make the affirmation in that way that client is motivated to continue your session. Okay, even if you are not with the client, they make them client to read every day, so that they are stick to in action mode. Whatever you are giving homework, okay, make a affirmation that I am doing the homework every day. Yes, Swetaji.
I wanted clarity on the affirmation part only.
Yes. Yeah. So you make the affirmation according to that. The if client is, you are giving the homework, client is doing, okay, I'm doing the homework every day. Okay, I'm regular on the session. Okay, I'm on time. Okay, I'm doing the intention setting every day. Okay, so likewise, you according to the client situation, looking at the client problem, you set some affirmation. Okay, make them write in the very first session. Okay, keep some space for goal writing, keep some space for affirmation writing. Okay, and give the client also. We use now 1 to 10 scale. Okay, so add that also and ask the client to rate every day. Okay, and whenever the goal is complete, ask them to tick it. Okay, so when we are saying or when client is visually experiencing those now, what happened? Client feel like it is very more. Client is more connected. Okay, I have achieved this one goal. Okay, if you have they have wrote the 5 goals, and every day they are saying that only one goal has completed. I need to work on me to reach all the goal. Okay, that's automatically give a motivation to client. Okay, so you can print out or you can give them in a paper, whatever you comfortable for you. Okay, so in the layout, so you just add some point. I made some point for this session structure. I make the structure at what will happen in the further session. Okay, why client will show up. Okay, so if you show them the like you through the layout now, what I told you to make the layout. So through that, what you do, you just show them the consequences. If they follow the whole treatment process, what will they get? Okay, if they just drop out in between, what will happen? Definitely it will, they will relapse, right? After the some time, the condition will again appear. Okay, so if you when you do this process, the client will be motivated, much more motivated. Okay, so you don't have to put effort. So this is the help out. Like I when I use the I could see the result. Okay. Yeah. So any question till now?
Can you please repeat that goal setting card, ma'am? How
Yes.
to?
So make a card ना simple in a like in a square form. चलो मेरे पास था मैं नहीं लेके आया. Like you can say this, है ना?
Yes,
In
yes.
itna in this size, okay, or it can be this much also, okay. The small
Okay.
card which can be handy. Okay, so make them write down, make them client write down the goals of the session. Reset the goal now. If a client is coming to you, so we'll have some goal for each session. Today we'll work on your procrastination. Okay, after that we will work on your laziness. Okay, after that we will work in your inner child healing. Okay, after that we will work on your mother and mother relation. After that we will work in your father relation. Okay, so client will come with some problem, right? So according to that, we try to make the goal in the very first session, right? So when we make clear out the goal, so client will have in mind, okay, I need to clear all this. I'm in the very first step. I'm here. Today I'm here. So I need to reach here. Okay. For that, what I have to do, I have to continue this session. I have to complete my homework. Okay. If I fail to do so, I won't be able to reach here. Okay, once the one goal is achieved, just ask them to take mark.
So what should be the gap between the first session and second session, according to you?
1 week, 1 week. I do in 1 week. Okay, but in some time, like some very rarely happen when client is very distressed. Okay, something happen in between. Okay, you can take a session for that. If client is insisting, because what happened, whatever we are giving in one session, that needs to be integrated, right? Their mind need to receive it. Okay,
Yes.
for that we client needs some time. 1 week is enough. 1 week gap is enough. Okay, so and also with the goal, writing the goal, they can also add the affirmation also. Okay, make the affirmation in that way. So, see here also, like I'll be very open here. Okay, you should also think about your. So if you have today a client, okay, so next day you need to have the client at least 1 month, right? if we are like minimum 4 session for a simple, very simple problem also, we need minimum a four session, right? So if client is today the client took 1 session and this client is not coming for the other session, you know, so you also have to struggle to find a new client, right? So in this goal card also benefit for you also and for the client also. Okay, you are not taking the money from the client only for your benefit. Client will be healed, right? But maximum of people doesn't realize what happened now when actually this idea came to me because I felt that some of the client, what they do when it just after 1 or 2 session or 3 session, they just start feeling good. Okay, and they feel that this is the outcome. Okay, I'm feeling good, this is the outcome, and something will happen and then they will call up suddenly कि ये हो गया वो हो गया बहुत problem हो गया. Then what happened
Yes.
for as a therapist, for us also it become problem because
Yeah.
it is relapsed na? This time symptoms become worse. Okay, but they doesn't realize. Okay, so as a therapist you have to keep in the monetary thing also and the client benefit also. Okay, so when you make the goal card, it is like client stick to the schedule. Okay, so add affirmation. Okay, affirmation should be in a way that they are affirming to continue this session. Along with the other, you do for the other also the generalized affirmation so that it is helpful for them. Okay, and also they stick to the session schedule also. Yes, Anamika ji.
Limpy, but the emotional part जो है client का, the emotional problem cannot be eradicated completely, ना? So emotional, if the client is suffering emotionally, so we cannot eradicate that emotional problem completely, na, forever. We can give her healing at that moment, for it will stay for some time. Na? If she doesn't, if she or he doesn't continue with the healing part at her own even, so it won't stay for long.
Yes, so that's why I'm telling you now, okay, so that client also do homework because client has this expectation that I'm visiting the client, taking 1 hour of session, and that will help me. Okay, but as a therapist or as a healer, we give them some homework. Now you do this, you do Ho'oponopono, okay, you do affirmation. Okay, so we give all those. So for that, I'm telling that this goal setting or affirmation will help them to motivate it to that. To do that. Am I making sense, Anamika ji?
Yes, yes, yes. Thank you.
Resume is clear. Okay. Anyone have any question? No. Yes,
When we will understand that the person's issue is totally resolved and that he don't need another sessions.
So the you will like make the tracking with the goal, make goal goal card also, and also yeah, I just forgot to mention that one. We give that 1 to 10 scale, 1 to 10 scale, rating the 1 to 10 scale. Okay, so add that also in the goal card, so that client can rate every day. The making the rating from the very first day until the last day. Okay, if client is saying that my distress level is today out of 10 it is 9. Okay, if you are giving some session, then after that it will heal, right? So what happens sometimes client also doesn't acknowledge that they are improving. Okay, so when you make them realize that, see, yesterday you told it was 9, but today it is 8.5, so you are at least recovering 5 points. Okay, as compared to the previous session. Okay, so in that way you can make a track on once the goals are resolved, So definitely you can terminate with the client. All the goals are resolved.
Libby, can you give one example of goal setting?
Okay.
Any case you can tell?
Sorry.
Example of any case.
Okay. Where is the goal card? Okay, so if a client is coming with the anxiety issue, okay, so very first goal will be our to become relaxed and calm. Not in the anxiety only. If you go for the any client of patient, so they definitely deal with the presence of anxiety, restlessness. Okay, so all those are very common symptoms. Okay, so our very first session should be focused on the relaxation and the calmness. Okay, so next client is telling that so next day what we can do, we can find out the cause. Okay, next day session goal setting can be to find out the cause of the root cause of the problem. Okay, so according to that what we can do, so then after, so all those can be, you can add in the layout. The first day we focus on the goal setting, second day we focus on the find out the cause, in second session focus on the find out the cause. Okay, so then according to cause we will choose therapy module, right? So according to the, so if someone asked about the inner child healing, so I'm giving that example only. So for the inner child healing, so very first session will be in the relaxation. Okay, I won't be able to take them directly into the hypnotherapy if I'm choosing. Okay, so very first session will work on the relaxation, and then second session maybe we can go through is if I am doing as a regression. So I can come up like complete half of the age, like 1 to 5 years of age in the very first session. Okay, in that way we can set the goal that in the second session in the next session we will work on the inner child healing from the age group 1 to 5 years of age. Okay, in the next session we'll work on the 5 to 10 years of age. Okay, so I'm giving this example if someone is having very so much of trauma. Okay, so
So
into
this is
one session, sorry,
this is from what
let me
modality?
complete. Yes,
This is from what modality?
inner child healing. Inner child healing. I'm talking about inner child healing with the hypnotherapy. Okay, so in
What
that
therapy
way,
is?
hypnotherapy. Okay, so in that way we can set the goal. Okay, if we can work on a simple symptom also. Okay, if client is coming with the obsessive compulsive disorder. Okay, so contamination. Okay, so today we did if I'm doing with the cognitive drill therapy, so today we did drill for only one, like you just can mention that for this belief we have done the drilling. Okay, we will be drilling in the next session. Okay, so according to the symptom of the client you can just set the goal. Okay, did I make sense or did I able to explain, Sweta ji? Okay.
My question was like normally we practice CBT, REBT, and all.
Mhm.
But when we
In
talk
the
about family constellation, Akashic record reading, all these are on the lines of like mystic kind of thing, or low, you can say spirituality dimension.
Mhm.
So now, is it easy to convince people to switch from CBT to these modalities? Like, do people agree with this?
it's up to you, na. The client, see, client's motive is what? Okay, I need to get a resolution.
Mhm.
My problems need to be solved. Okay,
Mhm.
so you can be you are able to convince that in this modality I'll be able to solve your problem.
Okay.
Okay, in CBT I'll take 10 days to resolve it.
Mhm.
Okay, but if I do family constellation I'll take only 5 sessions.
Mhm.
है ना? So everyone motive is to get it resolve it earlier, as early as possible.
Mm-hmm. Okay.
Okay, so next Sunday I'm conducting an art therapy workshop. Okay, if you guys would like to join it, you can join. Okay, so we'll discuss mostly benefit of the art and color therapy. Okay, and also different activity to release emotion, anger, okay, other negative emotion. Okay, then basic interpretation. Okay, some basic interpretation by looking at a picture, what can you can identify. There's this what if you see na, some of the children they do doodling and all in the last page of their copy. Okay, so looking at those, or if they are making some any picture in the last page. Okay, so looking at those, what we can identify. Okay, so basic thing will be discussed, and the art therapy and color therapy, how this can be helpful in cancer, depression, anxiety, post-traumatic stress disorder. Okay, if you're working with school children, how it can be helpful. If you're working with phobia. Okay, so art therapy, you can collaborate with this so many therapy. Okay, understand. So art therapy also people who are more connected with the art and artistic activity. Okay, so their subconscious thoughts in the subconscious mind will easily like change with this art therapy. Okay, understand how effective art and color therapy activities useful for group therapy, corporate session. Okay, so for those, art therapy activity is very helpful, because when it comes to taking group session, we are very like blank. What should we take in the group session? Okay, so art therapy activities are very much helpful. And art therapy activities, you can collaborate with the more than 10 therapy module. Okay, then it can help to change negative beliefs. Okay, in inner child healing. Okay, express yourself. Okay, all those things will be discussed. Okay, and it will be on 15 November, that is on Sunday, 6 to 9 p.m. It will be for 3 hours. You will get a recording, study material, and certificate. Okay, and the original price is 2,999, but it will be only for 999. Okay.
So it will be different from what we learned in the previous training?
Yes. I'll add some interpretation part here. Yeah, like more. I'll add some more content from the interpretation part. Otherwise, all those
Okay.
things will be. Activities will be definitely different, and the interpretation part I'll add more. Okay.
So, ma'am, can you repeat that on 15th December, the session on topic?
Google. Hey, art and color therapy. Just a
Okay.
minute. Yeah, this the topic will be covered.
So we are like already art and color therapist.
Yes, yes. So you guys, I ask for all of you, na, you guys can take session in free for the group session.
Yes.
Okay, so anything you guys would like to cover, or any feedback, anything you would like to say about the session?
Linky, when will you share the link for the payment?
Yeah, this is the number, the same number you paid for the no, that session.
It's your very number, na, I suppose.
Pendulum,
Right,
pendulum
right,
does.
right, right. Thank you.
Okay, so anything about the session, would I able to give some value to you all?
Yes, this session was valuable, ma'am.
Yes.
Limpy, ये जो career counseling, I just want to know about it. That uh, with which modality can we do it? How can a modality be helpful in it?
For what?
For children's career counseling?
Okay, career counseling, this is completely different. These won't be able to helpful in. So we have some test in career counseling.
Yeah. So one of the
Mostly tests are
participants,
important.
she was talking about career counseling, so I thought it is associated with the modalities only. I suppose
No,
Lima
this
ma'am, she was talking about career
no,
counseling.
no. So career counseling, we need to perform some tests.
Right, yeah. That I do know, but I never knew. I never heard about modalities involved into all that.
Okay, okay.
Thank you.
Welcome. So hope the 1.5 hour of your not in waste.
You teach
Because
hypnotherapy also?
yes, but not started. Like we started only one batch. I think it completed in October. Yeah. After that, not continued yet. But will continue from December, not maybe from January. Okay, guys, then we'll
Thank you.
end here. Most welcome.
Thank you so
Thank you,
much.
Limpy.
It was a great session.
Welcome. Thank you.
Yes, ma'am, it was helpful.
Thank you, Limpy. Mm.
Thank you.
Bye.
Thank
Bye bye.
you.
Thank you, Limpy. Thank you, sir.
Thank you, Lindsay.
Welcome.